Two of those are healthcare workers at the Lynn Valley Care Home. Another two cases appear to have been contracted through what's called community transmission. Both patients there are isolated at home, and doctors are trying to figure out the source of their illnesses. Three other new cases involve travel. A woman who recently returned from Egypt, a man who was in Germany, and another who was on the Grand Princess cruise in February. Now, lots of parents, speaking of travel, and students are preparing to travel for spring break and wondering if they ought to go. A provincial health officer urges people to know which countries to avoid.
Be very aware of where you're going. There are travel advisories that Canada has put out, including one that that advises against travel on cruises and travel to certain countries in the world. I would adhere to those. I think travel within Canada is still very safe, and certainly here in BC, it's very safe.
Henry adds, because of the outbreak in Italy that has essentially shut that country down, they are now asking anyone returning to BC from Italy to isolate themselves for 2 weeks, the same as travelers from Iran and China's Hubei province.
Okay, Dan, we've also seen a surge of coronavirus cases just south of the border in Washington state. What are British Columbians being told in terms of actually traveling to Washington state?
Yes, 74 new cases, Anita, and 2 new deaths there. We know that it's been concentrated at the Kirkland Life Care Center near Seattle. Dr. Henry says they are having unrecognized transmission and outbreaks in that state, and people need to be aware and, as we've heard from her earlier, take some basic precautions.
Certainly not travel if we're ill ourselves, and if we are somebody who is at high risk of having severe illness or dying from COVID-19, to reconsider travel to any of the areas where we know this might be a risk. Otherwise, taking our usual precautions, but being a little extra careful, staying extra distance away.
And back here in BC, there was a lot of news at this news conference today. If there is a glimmer of good news, Dr. Henry says a woman who was in ICU in critical condition at VGH who had coronavirus is now stable and at home. Anita, Mike?